Hi, I'm Dr. Sue Ishaq at the University of Maine. You can catch me on social media at Dr. Sue Ishaq or contact me by email to sue.ishaq@maine.edu. In this presentation, I would like to share my research journey over the last 2 years, introducing the Microbes and Social Equity Working Group, considering the microbial components of social, environmental, and health justice. I'm an assistant professor of animal and veterinary sciences at the University of Maine. I've been here since September 2019, where my lab focuses on the gut microbiome, primarily in livestock animals, but also wild animals and humans. I'm interested to find out how lifestyle, environment, and host health all intersect with each other and with microbes. My work is highly collaborative, as that is way too much for one lab to focus on by itself. Microbes are ubiquitous and pervasive, including the ones found in or on humans. Through decades of research, we now understand that microbes are integral to our health and well-being, and collectively our microbes are thought of as another organ in our body. For example, in the human gut, microbes are helping us process our diet, including plant fiber and other nutrients that we can't even access without microbial help. Public resources can affect which microbes we are able to recruit to our bodies or that we interact with in the world around us. When I talk about access to public resources, there are many examples to choose from, but some really clear examples are food nutrition, shelter and safe housing, and healthcare. Having access to these can help you accumulate helpful microbes and avoid interacting with potential pathogens. In early 2019, I was mulling over the idea of microbes and social equity, and if we had a right to microbes. I thought it was a cool idea for a class, so I pitched it to the University of Oregon Clark Honors College as a summer colloquium course and taught it in June and July of 2019. I had 15 undergraduate students, only a few of whom were biology majors, and the rest were humanities majors. In just 4 weeks, I taught them about relevant microbial ecology and examples where social policy or inequality could affect your microbial exposure and health. The students were really engaged and we had some awesome discussions. The concept of microbes and social equity poses the question of whether we have the right to microbes, and thus whether social policy needs to support beneficial microbial exposure. The culmination of that course was an essay co-written by myself and the undergraduate honor students, and I just want to take the opportunity to reiterate how proud I am of their hard work and dedication to this publication. The essay also included several research professionals who gave guest lectures and helped us refine our writing. The manuscript was peer-reviewed and accepted at PLOS Biology and included in the Microbiome Across Biological Systems special collection in fall of 2019. In part because of the interviews, and because of the high-profile reputation of the journal, other researchers began contacting me and asking what was next for microbes and social equity. By this time, I had started my faculty position at the University of Maine, and I was planning to focus my research on microbial communities associated with livestock and health. I thought that microbes and social equity would be a small side project. So, in late 2019 and early 2020, I hosted a few meetings with a small group of like-minded scientists to share our ideas. Instead of fizzling out, interest and membership grew, and I established the Microbes and Social Equity Working Group in January of 2020. Membership is free, and anyone is welcome to join online. The first thing MSC needed to do, and something we actively continue, is to learn each other's working language. As of November 2021, there are more than 110 members from over 20 countries around the globe. We also span career fields and level of career progression, and hark from dozens of fields of study. Each research or professional field has a different dictionary related to that work, and sometimes fields will use different terms for the same thing, or use the same word for different meanings. In order to work together, we shared our knowledge and perspectives and learned to speak each other's language. Next, MSC wanted to broaden the conversation because there are so many aspects of microbes and social equity that we could talk about. These are just a few ideas. There are already people doing incredible research, design, and policy work that we can include in that broader conversation, so we wanted to focus our initial efforts on hearing from those other researchers and bringing them to our table. One of the things we did this year to continue that conversation was host a speaker series to hear from other experts in this space. We ran our series in spring of 2021, featuring 14 speakers. We had over 300 total attendees, and because we were meeting virtually, we had people attend from various countries as well. There are recordings available online for those talks, and currently a spring 2022 series is in development. That speaker series paved the way for a summer symposium, which was also held virtually in June 2021. This featured 15 speakers over 5 days, organized into 5 broad themes. The 3 plenary talks each day were followed by a breakout room discussion and brainstorming featuring speakers, attendees, and members of MSE. There were 254 total attendees from 22 different countries, and a 2022 event is also in development. Finally, this year we proposed a special collection to the scientific journal mSystems, which accepted and launched special series, Social Equity as a Means of Resolving Disparities in Microbial Exposure. The first contribution was an introduction to the group, and 24 other papers will be joining that over the next year. Our debut scientific article features 35 of our group members who sat down to formalize our goals for research, education, and outreach. We also drafted a group mission statement. Quote, "The Microbes and Social Equity Working Group posits that microbial exposures across ecosystems, urban and rural settings, and individuals are socio-political. Our purpose is to connect microbiology with social equity research, education, policy, and practice to understand the interplay of microorganisms, individuals, societies, and ecosystems. Collectively, we seek to generate and communicate knowledge that will spark evidence-based public policy and practice supporting equity and sustainability for all." Now that we have grown the group and the expertise everyone brings to the table, shared our experiences, and begun learning from each other, we want to provide more professional development training for people in the group and in research in general. We feel that it is important to help others take that same journey so they can improve their research and education programs too. We have started with making general recommendations and are in the process of designing a project plan around this idea. We would also like to engage with policy more, but as most of MSE comes from research fields and academia, first we needed to learn how to do this. And we don't need to reinvent the wheel, we just need to be part of the conversations to help our science be used for beneficial outcomes. To that end, we are growing our collaborations with social scientists and policy researchers and engaging in conversations and information outreach to policymakers. I would like to end by acknowledging a few of those who have supported us, first and foremost being the 110 and counting members of MSE who bring their enthusiasm and ideas to the group. Their collective fire is what has brought this group to where it is today. And I continue to be grateful for the effort of the original MSE class. I would also like to thank mSystems and an anonymous donor for sponsoring the journal collection. I would like to thank the University of Maine in general for its support, and specifically the Institute of Medicine and EPSCoR for supporting our speaker series and symposium. Thank you so much for attending this presentation.